Asthma is an incredibly common pediatric problem. It's actually one of the most common problems that children are admitted to the hospital, and one of the most common problems that we see children in the emergency room for.
I'm part of a group of 9 physicians who work in the hospital overnight during the day. We take care of babies from the time they're born, and we send them home healthy. And if they come back with illness at any age, we take care of them up to 18. So now we have outpatient pediatricians who primarily focus on clinic work, and then we have the pediatric hospitalists that focus their work in the hospital. We also have a very unique relationship with the University of California, San Francisco. We are an extension of their program essentially, and so we're able to communicate very closely with subspecialists when our patients require more complicated care than you ordinarily would at a community hospital. While patient care is at the center of what we do, we're responsible for things behind the scenes that may not be as apparent to families. One is the coordination of care. We look at the structures and the systems and how we deliver the care to children to make sure that we're looking at ways to continually improve the quality. So one of the projects that we have here is the Asthma Project that Dr. Caldwell participates in. And what she did was help design a pathway for these children so that we can standardize their care, but also make sure we're following certain metrics and measures to make sure we're hitting certain benchmarks.
At Washington Hospital, we have been working with UCSF and the American Academy of Pediatrics to focus on asthma care. Since 2017, we have been working on this national study, and we're one of the sites for the American Academy of Pediatrics. And we are trying to identify specific patients quickly as they are coming into the emergency department, and making sure we are identifying how severe their exacerbation is so that we can intervene very quickly. We also want to make sure that we are formulating a treatment plan with parents, that we're identifying triggers for each child's particular asthma. We want to identify if there are things in the environment that are contributing to their asthma exacerbations so that we can try to avoid those things. We also want to make sure that families have an asthma action plan, that they know what to do when a child is starting to have symptoms, and then to identify when that child needs to come in to see us. We want to make sure that we are educating the parents about things that they can do to help prevent their child from having bad exacerbations and prevent them from coming into the hospital. We also want to identify patients who are being exposed to secondhand smoke exposure and refer those families to counseling and resources in the community to help quit. So if a child is having an asthma exacerbation, then they may start having these symptoms of wheezing, coughing, difficulty breathing, and chest tightness, and that may continue to worsen if they don't receive the proper treatment. So those should be the things that the family is really looking for, to identify those things and intervene if needed. And do you want to sit on the bed? I'm probably just gonna, you don't know? You want to sit with Mama?
Fiona had difficulty to breathe, and then we took her to Washington Hospital to cure the asthma. She's 5. Yeah, it's pretty much scary, especially if you feel she cannot breathe. That's kind of scary for us. I think Washington Hospital is like a home for us because everybody's so friendly and always can give us very good advice. Yeah, and they really take a good care of us. That's the reason we like it.
Dr. Caldwell and our other physicians have really worked hard on putting together this really up-and-coming asthma protocol, and it's really been great because the RNs and the respiratory therapists are able to work together to help our children get back out of the hospital sooner rather than later. Being able to take care of children that live in the area is a really big benefit for our community members.
Hi.
Hi, how are you? Nice to meet you.
Thanks for coming in.
Brian.
Who's this?
Can you say hello?
Who's this?
I feel like they actually take their time to figure out what's going on with Ryan. Like, they're not letting him go anywhere until he gets better. And that's what I appreciate, because they're not just sending me home with my child knowing that things are going to get worse. And so that's what I like, that they actually pay attention to him and they actually care.
We have a great group of providers. We have a great group of staff that really take pride in what we do. And I think the focus on these quality improvement projects like the asthma pathway that Dr. Caldwell worked on really make a difference in how we care for patients.
Learn more about Washington Hospital's Pediatric Hospitalist program at BayAreaHealthierTogether.com.